All right, good afternoon, everybody. My name is Sherry Obrentz. I'm an Associate Dean in the College of Arts and Sciences, and we want to welcome you to our second Family Friday webinar series, where we will be discussing the transition of care. Before we get started today, we thank you all so much for joining us. Today is Juneteenth, and for the first time in our university's history, we are recognizing this day. Actually, the university has an early release as of now, where we are encouraging our faculty, staff, students, and others to really reflect and engage in exploring issues that challenge our shared understanding of our history. So we really appreciate everybody taking the time to spend the next hour with us today. We will introduce all of our panelists in just a moment. We have a lot to talk about with transition of care. And we understand there are lots of concerns around COVID issues as well. When we set out to start this presentation pre-COVID, we wanted to share a lot of information for you, and that doesn't change. So all of the information we're sharing today is good to have, and just the conversations we hope that you and your family and your students are having with for the rest of the summer. We will also direct you to the emory.edu/forward website, where all of our up-to-date information and announcements, COVID-related announcements, will be posted. And so we understand that you might be entering questions in the chat, but there's still a lot that we are waiting to hear from the university as well. A few housekeeping rules. We encourage you all to participate in the chat and type your questions in. Bridget Reardon and I will be moderating this panel of experts who are going to share lots of great info with you. We will do our best to stop in between, read through the chat, and answer questions along the way. As all of our Family Friday webinar series, these are being recorded and will be posted on our orientation website by early next week. So without further ado, Bridget, I'll let you introduce yourself and we will get started.
Hey everybody, I'm Bridget Guernsey Reardon. I work with family programs with Emory, and I'm excited to be with you today. We have a real talented staff with us today that have years of expertise in their areas, and we know this is very interesting and also important for families to know how you get your student from where they were in high school to Emory University in a way that is looking at their transition of care and doing so in a thoughtful and meaningful way. So I'm excited that you'll hear from my colleagues, and I know that you'll have a lot of good questions, and they have a lot of great information to present to you today. So I'm really looking forward to working with you, with my colleagues. So how about if we have each of them introduce themselves? I'll let them do it themselves. They bring a lot of talents and many degrees to us today. So Sharon, if you want to go first, and then Wanda and Allison, and then we'll go and have you give us your information.
Hi everyone, I'm Sharon Rabinovitz. I'm the Executive Director of Student Health. I've been in Emory for 3 years, and I'm excited to take this journey with you into a very unusual and interesting year, but we're here to support your students. And again, we have wonderful people. You're going to learn a lot today.
Hi everyone, I'm Wanda Collins. I'm a psychologist and also the director of our counseling and psychological services and an assistant vice president in campus life. It's good to be here with you.
Hello, everyone. My name is Allison Butler. I'm the Director and ADA Compliance Officer for the enterprise and over accessibility services.
Thank you all. Well, we're going to jump right in. Also, big thanks to our new student programs team, Blaze Bowman and Jill Camper, who are helping us behind the scenes, making sure that we are acknowledging questions in the chat too. So we are going to jump right in with
Grads and doctoral interns. And then we Is that something on our end, or?
we'll check into that.
Okay.
We think it might be back, so stay tuned.
We'll call out. Julie Dodd has been the first to respond. Julie, can you hear us? If so, could you type yes in here?
Hear you now, she said. Thank you,
Hear
Julie.
you now. Great. Okay, Wanda, if you could start again, that would be great.
Great, thank you.
All right, I will start over. So I just wanted to welcome any students who might be listening, and also say congratulations to the family members for getting your students here. So I'm the Director of Counseling and Psychological Services. And as you can see from the picture, that's a picture of my staff. It's a beautifully diverse staff and a very caring staff. And we also have 2 therapy dogs, Beowulf and Finn. So they are sort of a highlight for students on campus. And we also hire additional therapists in times of peak clinical demand to help serve more students. Next slide, please. So the purpose of CAPS is really to support the academic mission of the university. And it's an important thing to keep in mind because unlike, for example, someone who's in private practice and they're able to offer really long-term therapy, our mission is really to serve all students and to help students succeed academically. And so with that in mind, we do offer therapy using a brief treatment model. We offer initial screenings to try and help students determine what would be most helpful. They can get referred to individual or couples therapy, assuming that both students are enrolled. Can we go back to the prior slide? Yeah, thank you. We have a number of groups, both therapy groups and support groups, and we also have population-specific groups. So we have Black graduate student group, we have sexual and gender diversity groups, grief and loss groups, interpersonal process groups. We have crisis walk-in hours Monday through Friday. So if students are really struggling and they need to talk with someone right away, we're available to them. We have a website called emory.thrivingcampus.com where you can go and look up local providers. You can search by insurance company, by profession, by interest. And they also have a map feature on this website so that you can see where the practitioner is located relative to campus. And then in CAPS, we have a stress clinic that has students can actually learn stress management techniques, and they're hooked up to biofeedback equipment or virtual reality equipment so they can sort of test out what works best for them. And then we do a lot of work in the community doing workshops and collaborating with campus partners around different types of outreach. And we have a number of online mental health screenings on our website. Next slide, please. So here are some of the frequently asked questions that we get, and you can find information about these and a lot more questions on our website. There are no charges for CAP services, but we do charge no-show fees, and our services are part of the health and wellness fee that students pay each semester. If students want to make an initial appointment, they can just call the CAPS number 404-727-7450 and ask to speak with a clinician, and they'll schedule that appointment. Those are usually available within a week, but we have same day if students are in crisis. And then we also have the referrals for off campus. And one thing to note, if your student has the student health insurance, which I'm a big fan of, then they will need to get a referral either from our office or from student health before they see their provider. And if they're in ongoing therapy, they'll need to renew that referral every August in order for those sessions to be covered. One thing that we often get asked is what do I do if my student is struggling? And of course, it depends on the type of struggling that they're having, but a good first place to refer them is to the resident life staff. So all of your students have a resident advisor or a sophomore advisor on their floor who's a great resource, and both for support, but also helping them connect with other offices on campus if that's needed. We have what's called a student intervention services team that will reach out to students if there's a need for that. We have our crisis appointments, and then of course there's Emory Police Department if it's more urgent. Next slide, please. So a few points about CAP services during COVID. Right now, we're offering all of our services via HIPAA compliant Zoom platform. And that includes individual therapy, our crisis appointments, all of our therapy groups, and all of our outreach and workshops. Everything right now is happening online. We anticipate in the fall that we'll continue to offer probably 90 to 95% of our services online. So we'll continue to do telehealth. We are having our in-person Fun Fin Fridays. So we use hand sanitizer and a long leash, but the students really enjoy seeing the therapy dogs. And then I would really encourage your students to get on our Emory CAP social media because we offer really great self-care tips every week. Next slide, please. Okay, a few things about the transition of mental health care. I can't stress enough how important it is to have a conversation with your student about learning to be educated about their own health care. We're really trying to support their stage of life as emerging adults. And so it's important to talk with them about how they use insurance, how they schedule an appointment, and also just the importance of self-care generally. A lot of things that get labeled in mental health terms really can be reduced if students practice good sleep hygiene, a good diet, regular exercise, the things that we all know, but we don't always do. Those are just really important. And you also want to make sure that you check your insurance coverage and compare the mental health benefits to those offered by the student health insurance. So you may have great insurance, but out-of-state coverage isn't great, or out-of-network coverage isn't great for mental health. And we know that a lot of your students may not want to tell you if they're struggling. They may not want to bother you. So it's really important to let them know that if they're struggling, you want them to know that you want to be supportive, that they can use their health insurance if they need to do that. If they've been in long-term treatment, you may want to go ahead and identify a local community provider that they can see for long-term therapy. And then the last thing I'll say about this is that it might be important to consider tuition insurance. And I believe on the student financial portion of the website, there's information about tuition insurance. It's not Emory specific, but there's information there. And if you think about the primary age of onset for most mental illness is between 18 and 25, it's really impossible to know if your student may have a condition, including a physical condition, that may require them to withdraw during the semester. So the tuition insurance can really be helpful for protecting your family financially. Next slide, please. Okay, and then I just want to say a little bit about crisis response on campus generally. So this is the staff at the Center for Student Success Programs and Services. And their office provides crisis response on the larger campus. So students can come to CAPS if they're in crisis to speak with someone, but sometimes the crisis support will go out. They'll reach out to students who may be struggling with academic issues or mental health issues, or maybe students who've stopped going to class, bring them in, find out what's going on, and then refer them to appropriate resources. They also oversee the Student Intervention Services team, which is a 24/7 on-call service. It's not a hotline, so if you call that, you may leave a message and you'll get a call back in 30 minutes. But they can respond to students who are in crisis. And then finally, there's the Respect line, which is for students. They provide support for students who may have experienced sexual assault or interpersonal violence. So those are just some really great crisis response resources. And then one thing that I'll say, just to go back, there's a student of concern referral form on their website. So if you're concerned about your student, that's a good place to submit a form, and they can reach out to your student. Thank you.
And before we move on to Allison, just thanks so much, Wanda. It looks like there are not too many questions in the chat, so we will continue on. And throughout this discussion, and all of our panelists can kind of jump in, really want you all thinking about what conversations you want to start having with your students now to set up some of those expectations. And we'll give you some suggested topics that you can have those conversations throughout the summer. But as you hear from each of our panelists, really thinking about what conversations you do want to have with your students this summer before they join us as college first years. So Allison.
Thank you. So as I mentioned earlier, I am with the Department of Accessibility Services, and we support students and employees with disabilities across the enterprise and meeting their accommodation needs. One of our goals is that we really want to create a space where we can have self-advocates and acknowledge give them the tools to really engage in dialogue across the campus community, depending on what their needs are. So specifically with students, a lot of times that might be in the academic realm, that could be in housing, it could be in transportation. So we really want to look at the environments and think about what barriers may need to be removed. So one of the things for our process is that it's really essential that students self-advocate, and they have to self-disclose to initiate a dialogue with our office. And the reason for that is because we are a federally mandated office. We really have to focus on how we really want to identify the students and really work on a plan to support any level of equal participation and removing certain barriers that they might experience academically, et cetera. Next slide, please. So we're very pragmatic and flexible. Our registration process has to start with your student self-identifying. And the way that they do that, we have information for all of our students online. They submit documentation. And that is helping us to make decisions in conjunction with their own self-report about what their needs are and how we can make recommendations about what accommodations would be best suited. Because of the current state of affairs that we are experiencing at this point, we really understand that, documentation may be harder to obtain quickly, and we have built-in considerations for that. We are very lenient to dated documentation. If there's any concerns regarding about a timeline to get documentation to us, there are certain things that we can consider on a provisional basis. The main thing is communication. So we really want you to let us know. We don't know if there's any problems going on, or you can start your students can start the registration process. But they might also want to share with us that, this is the documentation I have thus far. I have a telehealth appointment, or I am scheduled to meet with my psychologist. It could be a lot of different things. So just make sure you're just communicating with us and letting us know that. The registration process remains the same, whether it's virtual or in person. Once we get that information, each student there'll be an intake meeting that will eventually be set up. And this is to help us prepare a plan, an accommodation plan that the student will be able to use in their classrooms. If it's a communication that goes to housing for certain needs, if there's any mobility needs, there's certain things that we have that we can set up with different departments across campus. Next slide, please. So examples of accommodations, there's a lot of variants. There's academic and a list of others. So when we're making our decision about what accommodations are best suited for your student, pieces of what help us make that decision is the documentation, so we can get an idea of how their disability is impacting them. And it's also important for us to understand their past experiences, current experiences. So when we're making decisions, it's not just that, does everybody have extended time? It's just that what's coming up and that's impacting the student in this specific setting, so that we can make decisions about what accommodations would be best suited. So you can see, for example, like if we are looking at a student's ability to meet assignment deadlines, that could be because of a chronic health condition where they're seeking out treatment. They might have side effects from that. It could be a treatment regimen with medication that might be impacting them. These are certain things that we're looking at to make decisions about, hey, like flexibility with deadlines would be best suited for this particular student. So it's a really case-by-case process. And, I could have two students registering with us for ADHD, and they might have two different ways that they have different ways that they're impacted, and their accommodation plan will look very different. Next slide, please. And there's a lot of other types of accommodations. There's variations of types of disabilities and how they're impacted. And so what we do is, for instance, there might be a student, once again, if it's a chronic health condition and there's a treatment regimen that has to be incorporated, they might need a reduced course load because the impact, they have to maintain a lighter course load because, maybe because of the treatment, the effects of treatment. It could be quite taxing. It could be a lot of different cases. Next slide, please. Barriers to utilizing accommodations. A lot of times, we have different groups of students they have a variety of experiences. We have students that have utilized accommodations all their life, and they're able to navigate and reach out and initiate dialogue because they know that this will be useful coming to a different academic program. There's other students that may feel that they can just do this on their own and that they won't need to utilize accommodations maybe that they've received in high school, let's say. And then we have our pocket of students that have newly acquired conditions. So at this moment in time, they don't know if they need anything. So in the future, they might have to register with us for a lot of different things. So one of the things to initiate early disclosure is really important. And so sometimes when some students might want to wait until they get here and figure out if they're going to need something, that can be challenging. And we'll get into that in a moment. But we understand that, there's some type of expressed vulnerability in this. You have to really reach out, engage, and start the dialogue. But that's what we are here for. The university is built to support all students with disabilities as well as employees. So we just need to know and start the process so we can implement a plan that is best suited for your student. Stigma. Sometimes students, depending on their past experiences, they might have some ideas about what this environment's going to look like, or if they're going to experience challenges here. And that's not the case. Once the student has reached out to us and we can come up with an accommodation plan, based on the documentation, based on their self-report, going forward, they will have the tools to have those conversations about their needs without sharing any specifics about their disability. Professor perspective, faculty are very supportive in supporting all of our students with disabilities. It's just that they have to be informed. And so that's why we have that accommodation letter, which serves as that tool to have that conversation. And there's no disability information. It's just on this student has gone through the process to register with us. These are the approved accommodations, and this helps the faculty member have conversation with the student about, based on their class and what it looks like. This is what we can support you in doing, and this is how we'll implement this. So that's what's really important. And they're not, the type of disability is not important in that dialogue. That's something that we only have information on to help develop a plan for you. Overall, we understand all of our students experience stress, and these stress is significant in exacerbating certain conditions. So please know we do understand that, but stress alone isn't, what we would consider a disability. And we're still going through the same process to really identify what barriers you're experiencing, not just stress. In these environments, to make decisions about what accommodations are going to be best suited. Overall, for accommodations do not necessarily equate to success. Accommodations are really important because they are a right for every student who has a disability, in a sense that they experience certain things in managing their condition that their peers do not. So participation in academics, in housing, all those things may have to look a little different for them to make sure that they have equal access. And so that's essentially what the accommodations are built to do. So there are still things that all students, even students with disabilities, may experience. And sometimes it might be a different type of intervention. So sometimes students might have to make decisions to drop their classes. Some students that might have a chronic health condition that might, be exacerbated, in one particular flare-up moment and things like that during a semester. Sometimes they might have to seek out a medical withdrawal. We've worked with some students that might have to take a leave of absence, but those aren't specific accommodations. Those are specific interventions that all of the academic programs will, with, the college itself will work with each student to support them on that. Next slide, please. So COVID and accommodations, we understand what the current state of affairs are, and the university is making plans behind the scenes to support any student that might experience while on campus. However, that is not an accommodation. But it doesn't stop our process. We're still working with students. Anyone who's experiencing a newly acquired or a permanent condition, we want you to reach out and set up your accommodation plan. And we consider comorbid conditions. So the thing is that somebody might, with a disability who might have a accommodation plan already in place, they still may get COVID, and we will direct them to the proper source to, get the services that they need. And sometimes their accommodations can be used simultaneously with the plan that might be in place if they had to quarantine, let's say. Overall, the environments dictate the need, and that's what we're looking at in comparison to what, the impact of the individual's disability, and how we make decisions to make that plan so that they'll be supported in the different environments that they're in. And going forward, we will continue virtual registration. We're going to offer virtual walk-in hours. We're still engaged, and we're still going to be a support for all of the students. Next slide, please. And so overall, just some points to take away. Just as it's important for your student, any identified disability at this point, that may require some accommodations, especially if they've been used in high school, we definitely want your student to reach out. Please initiate the registration process. The summer is a perfect time. The thing is, students can register throughout the year. It's just that the later we get into the semester, the more challenging it is to finalize an accommodation plan and implement it. So for instance, if we don't want your student to, please encourage to come early, because we don't want them to wait until after they've taken their first test and they've, had some challenges. We can apply accommodations retroactively. So that one thing you'll keep hearing is that continuum of care. And so depending on what your student's disability is, they'll still be managing that. So whether it's a treatment regime, whether it's talk therapy, whether it's just managing like executive skill functioning, a lot of those things, we want to make sure that they still have the connected resources down there. So those are things that you want to be planning, especially if your student is coming out of state. And remember, student advocacy is essential. We want students to reach out, begin the dialogue. We can't seek them out without, their permission. So they need to reach out to us to begin the dialogue, and you can support them in that. But we really need to work with the student directly, because we're going to help them and give them the tools to have these conversations outside of our office without having to reveal any disability details. Thank you.
And I just want to jump in right now. There have been some great questions in the chat, a lot about insurance. We promise we're getting to insurance shortly. But around this idea of accessibility services, especially if your student has received any accommodations in high school. I know that coming to college and starting on a new campus in a new place, it's a lot of students think, well, maybe I won't need this accommodation, or I'm going to try it without it. Registering or connecting with the Department of Accessibility Services doesn't mean that you have to use the accommodation. It just means that you have access to it in the case that something comes up. Allison mentioned this, but I think it's really worth repeating. Nothing is retroactive, and you don't want to wait until there's a problem to start the registration process, because once that first test is taken, or if anything's taken without accommodations, you can't go back. So we kind of think of it, at least in the college, as a safety net, right? Registering, knowing what accommodations you're even eligible for, having those ready to use if needed. And if you never need them, that's absolutely fine, but at least you have access to them. But waiting, I wouldn't recommend that. I think if you're already aware that something has been going on or any accommodations have been used in high school, go ahead and at least connect with the DAS. Register and discuss options so that those are good to go. Allison, anything you want to add with that?
Oh no, that's definitely key. That's definitely key. And we understand that there's a lot of reasons that students might think that they won't need them. But as Shari said before, it's not a requirement. If they don't want to use them, they have the right not to. So it's just really important just to set up a plan ahead of time. Because if they do wait till the last minute, it is just going to take time, just because the care and support that we take for each student, we're doing that across the enterprise. So we serve graduate students as well, and we serve the college.
And something to kind of think about, your classes are going to be really different in college than they were in high school. And a student might be taking 3 or 4 different classes with different formats. And so it might be that for 3 out of the 4 classes, they don't use any accommodations, but for one particular class and the expectations, it might be really critical for success. So kind of thinking about that as well. There was one last question. I think this is a great one to end on before we move to student health services, about how to start the process. Allison's website is amazing, with literally a big call out for new students start here. But yes. Allison, do you want to share that website again?
Yes, it's accessibility.emory.edu. And we have information just for all the new students to get started. There is specifics about, we have tips about self-advocacy. There's information about documentation requirements. It's to be used as a guide, just to help you get an idea of what we need. As I said before, we will accept dated documentation. at this point. And for instance, just make sure that you're communicating with us. Like if you have an upcoming appointment, like you have, you know, my student had the last test was done in 6th grade, but we're doing a appointment with a psychoeducation specialist. So just let us know when that's coming, because we just want to put you in the queue, because once you have updated information, we'll make sure that we're reaching back out just to get all that finalized. But there's certain things that we can set up provisionally. And once again, there might be those groups of students that you right now don't need anything. And so just make sure that you keep in mind that we do exist, just in case there's something that's newly acquired or something that's been officially diagnosed in the future.
And there's one thing I'd like to add too for families is that please consider the accessibility services offices as the hub. They communicate with the other offices. So don't call the housing office, because they won't be able to help you unless they've already heard from accessibility services, even though they'll want to. And everything is covered in a lot of confidentiality. So you can't call one of our other offices and try to get what you need to go to accessibility services for. They are the hub, they are the people, and they're the experts. So we want to make sure that you can streamline the help that you need.
Great. Thanks, Allison.
Yeah.
I know you're all been waiting excitedly to hear about all of our services in student health. So Dr. Rubin, you'll take it away. We can move to the next slide.
Well, it's great to be here with you today, and we have so much to cover. I know you have a lot of questions, so I hope I'll get to answer most of them, or at least I'll send you in the right direction to find them. So the goal today is how to access health care, which is really important, obviously, review the immunization requirements, the insurance requirements, and also access to information about it. And we'll touch on COVID-related information as well. We are located on the north point of the campus. We are marked by the most stairs in front of a building. There is accessibility around the building, so it does look daunting, but there is accessibility. We are opened every day, including Saturday during the semester, and these hours will flex to meet accommodations for COVID if we need it. Our summer hours right now are 8:30 to 5. We do have after-hour accessibility as well. There's a medical call center that takes calls with provider backup, and so that's 24/7, 365. Next slide, please. So the good thing is every student gets to see a provider without a charge. So if you see a nutritionist, psychiatrist, family physician, it is without a charge. That is rolled into your tuition. The charges come when you have a lab, vaccines, procedures, and that's based on the insurance that you have and whatever that coverage is. So again, knowing the coverage for your own personal insurance and sharing that with your student is really important, because it's a whole different language for us. As even in medical field, it's a different language. So, you know, we can't even imagine what it's like for somebody non-medical, much less a student. So it's a whole different language we want you to share with them, like what's a deductible, co-insurance. It's very confusing. But so that is something that they would need to know as far as fee for service for anything other than a visit. I'm a family physician, so my philosophy is I want to provide as much full breadth coverage for when you go to your primary care doctor, just like you would in the community. So that's why we have specialty services, immunizations, procedures, and so forth. So next slide, please. So we do have a wonderful, and I think this is going to answer one of the chat questions. We do have a wonderful portal. So a lot of the forms are available on the portal. If it's not on the portal, there is a great new website. We just updated it this year, and there is a forms tab. I think it's in the quick links. You go to forms and you'll be able to find all your forms there, and you can send that in. We operate by an appointment system that you can access by the portal. And there will be some of these things will change and shift based on the impact of COVID. So, and we will keep people updated on that in the portal and the website. We do have urgent care visits. About 50% of our visits are same day appointments. They come out, and this is a very important point, they come out the night before. So if somebody is looking for an appointment 3 days ahead and all of our well visits and clinical appointments are filled, it doesn't mean we don't have appointments coming. There's 50% openings, but they open the night before. So we never have a point where we're completely full the day before. So the student just has to go on. They open up around 6 o'clock the night before, and they open up every hour. So just tell your student if they can't find something to go on again. Or call the front desk, which the number is written there, and we will be happy to fit people in as much as we possibly can, or set them up for an appointment soon thereafter. Also on that website is billing information, immunization, upload information, and then all the consents. FERPA is a really important topic. That could be a webinar in and of itself, but making sure that you have that discussion with your student about FERPA, and making sure that you're on that FERPA release if that is the desire of your student. And again, the patient portal information is right there, as well as our Emory website, which is a great resource for everything that we're talking about today. Next slide, please. So it's all about, and this is in the community too, it's all about finding the right level of service. And luckily we do have, again, full breadth family medicine, a lot of urgent care can be taken care of within student health. But if it's after hours or on the weekends, we have the call center that can direct you in the right place. We are very fortunate. We work on and live on an incredible medical center campus, but the Emory ER might be not the right place to start, and it's busy and it's expensive. So there's a lot of really good immediate care within a mile or two around campus. Peachtree Immediate Care is actually on the Emory Healthcare Network. We collaborate with them closely. We have access to their EMR we have access to, so we can coordinate care really well. There are some other ones around the area if you're not on the Emory insurance. But again, we are very fortunate to have Emory University Hospital right on campus. We again are not a emergency care system, so we don't want students to come to us for an emergency. They have the emergency availability, emergency services available on hospital. So we're very fortunate in that sense. Next slide, please. So immunization requirements. We're getting into some interesting topics now. So the immunization requirements are set by the standards for the CDC and American College Health. They're going to be part of the onboarding process. More information to come as it relates to COVID, but it's going to be very important, even more so this year, that our students are completely immunized when they arrive on campus. So that is not another confounding factor for health and safety in the context of COVID. So that more information on how that is going to be rolled out. In the past, and this will actually, the process for them is very much similar, is they have to go to the portal, they enter the dates of their immunizations, they upload the form. We've had a lot of challenges this year because access to care has been limited for the past couple months. So we are taking state registry that is signed by your pediatrician or your family physician. So that could be uploaded, as well as a previous institution's registration of immunizations can be uploaded as well, in addition to our form. So our form is taken to the provider fills it in and signs it. That is a preference, but again, we're kind of broadening some options because we know it's been challenging this year to get that done. The video that is on our website has all the steps that are needed for updating your immunization requirements. And we have a great immunization requirement team, compliance team that you can reach out to either through the portal, immunization compliance. They can send a message, or they can call, or they can email. All that information is on the website to handle any challenges that you're having right now. Next slide, please.
And Sharon, actually, as we're moving through, just quick questions we've been having about some forms as well. If people are having any challenges or things haven't been accepted, we'll go through those emails as well of where people can email to double check where they are with the coverage. There are also some questions about care for students who are under 17 and forms for that. So that might be coming up just shortly, but we see those in the chat and we will get to them as well.
So for care for 17-year-olds, the form for consent of minors is on our website. So that just needs to be filled out. It can be uploaded into the portal. So it's there for when the student arrives. It can be given to the student just as long as it has your signature. So that's something that you could do preemptively. And the form is not on the portal. It has to be taken from the website and uploaded into the student portal. So that's an easy thing that can be done beforehand as well. But as far as immunizations, there are the required immunizations, which are detailed on the website. There are some recommended immunizations. And the reason why I kept this on this year is to highlight flu, because there will be probably stricter mandates about flu this year, especially because it can confound the COVID presentation in the fall. So we want to make sure that people are aware of that campaign that will be happening over the fall, but more to come on that. So next slide, please. So do you want to talk about insurance? I think there's a lot to talk about. And then, like I said before, it's a whole nother language. It's very complicated. So I'll touch as much as I can on this in the time that we have. So every student must have insurance. It has to be valid in Atlanta. We do have criteria that we have set out for our waiver. We do have an audited waiver system this year. It is an opt-out process, so you have to, you're automatically put onto the Emory University Student Health Insurance unless you opt out, and that has to be done every year. The waiver is completed by September 15th. So we gave people a lot of time to kind of look at the different options and capabilities of the Emory Student Health Insurance. We have a lot on our website to kind of compare and contrast. We are updating our benefits package for this coming year, but it's very similar to last year. So you could look at the benefits, the summary of benefits from last year. If you want to compare and contrast. Anything that's done at student health on the Emory University Student Health Insurance, which is called USHIP for short, is covered at 100%. So the visits, as always, are covered at 100%, but all labs are covered at 100%, as well as immunizations and procedures. The only thing that's not covered at 100% are X-rays. X-rays on our in our campus, in our facility, is actually an Emory University healthcare X-ray, and so that would be covered at the rate for which we cover Emory University Hospital, which I saw that in the chat, and that's $150 deductible and a 90-10 split, so it's covered at a 90%. So that's a lot so far about insurance, but we can move forward to the next slide. We do submit for many other insurances. So we obviously have a significant portion of our students on USHIP, but even more so not on USHIP. So we want to make sure that we're engaging in that process. We will submit claims. If the insurance is denied, we do not go back and forth with them. We will give you all the information for you to resubmit and help navigate that process. We do not have a contract with TRICARE and Kaiser and Medicare and Medicaid this year, which is great for this incoming class. We will be taking Blue Cross Blue Shield. We were able to negotiate a contract for them for this year, which I think everybody's going to give a little cheer about, knowing that it was a really big gap that we could not fill, and now we can this coming year. Next slide, please. Are there any other insurance questions that we wanted to make sure we covered?
Sharon, there is a question about international students. You might have covered that a little bit. And then also a question about if a student chooses to come second semester and is not on campus first semester.
And that's one of the things we're actually working through right now, because it's one of the things that we're creating as we go with COVID response. So with immunizations, I would urge everyone to do it now because we don't know who's going to be coming and who's not going to be coming based on our system. Our system's separate from Opus. So we're encouraging everybody to upload and document as much as you can. If there are gaps, we can fill them, but whatever you have available for your student, please upload it and submit it now. Excuse me. As far as insurance goes, there are two things that are happening. We're working with our auditor to, if somebody is going to be staying either home domestically or home internationally, that is something that is built into the auditor auditing piece, so that it will meet the waiver criteria for this time. We're also working on the OPUS side so that we can run reports to make sure we're capturing those students who are going to be staying home and are online and have not waived, so we can make sure that in that combination, we capture somebody who really doesn't want to be on the insurance. So we're working out those processes right now because we know that a lot of people are concerned about that gap right now.
Great. And families, just remember there's a live chat function on the side, and our administrator is answering a lot of your questions that you might still have. So just check that, and there's some information there that'll be helpful to you. Okay, Sharon, back to you.
Thank you. So COVID and student health, obviously we're intimately involved in that process, and we all know the importance of testing, isolation, quarantine, and contact tracing, and we are creating all of those responses as we speak. My team is working very hard as we speak on all those things, and all the details will be rolled out over time. We already have a complete, excuse me, frog in my throat, excuse me, a complete COVID triage assessment and testing process already in place. We have a testing site separate from us at this point over at the Claremont campus where the students are over the summer. We wanted to make sure that that is intact and full service for the students who are concerned about COVID, and also for testing for mild symptoms. So that is active and already set up. That will be probably changing in dynamics, and also with the volume that we will need in the fall. So that is active but dynamic. So more information to come on that. We did stand up, just like with CAPS, we did stand up telehealth. So we are doing telehealth to accommodate a lot of the students. Unfortunately, it's only for the students in Georgia right now. But we will be offering that in the fall for those students who would like that, even if they're in Atlanta and don't want to be on campus. We're having a significant amount of students who are online, but in Georgia, we will be able to accommodate them via telehealth. We do have testing. Testing, as we all know, is completely dynamic and somewhat confusing. Right now, we do have the PCR, the RT-PCR, the real-time polymerase chain reaction test, which is the nasal test, and it's the full nasal test, the nasopharyngeal test. We are doing that, and we're doing it in conjunction with Emory Medical Labs. So that is already in place. We are looking at other options for when people do on board, as far as the antigen testing and the PCR testing. And showing how dynamic this is, we have put in place antibody testing that's available. I do caution that we are not necessarily recommending antibody testing right now, because it's not clear what that means as far as clinical intervention. So we do have it available because in some cases it will help us clinically, but for most, screening with antibody is not recommended at this time. But as we all know, that will probably change over time. We are very fortunate to have many, many resources on campus. You probably recognize some of these names who have been great resources and colleagues during this response. Next slide, please. Psychiatry. So I wanted to let you know that psychiatry is under student health, and this is the contact information. No referral is needed. There is not a limit in the charge in the sessions, and it obviously is private and confidential, as everything else is in student health. We have a separate system from the university contained within student health, and we collaborate very closely with SIS and CAPS. Next slide. And psychiatry is on the first floor of the same building. So we have a lot of checklists, but here's what to do in this time of transition. And we've talked about this a lot in the context of what Dr. Collins and Dr. Butler already said as far as immunization requirements. You can do that now. The deadline has been pushed back because of all the changes to July 15th. Do the FERPA forms now, do any of the consent forms that you need to, especially for the minor, which is really important. Do the health history. Insurance waivers due September 15th. Do your research, and you can always reach out if you have questions. We have a great team who's ready and willing to help with that, because it is hard to navigate. there's some other information to remember. Is there any other questions that have come in the chat that?
Yeah, Sharon, there was a few about two actually. One is, does care, if students are on the Emory health insurance, how does care transition when they're back home? And what are they covered for at home? And yeah.
So it's a Aetna product. So if you are seeing an in-network Aetna provider, it will be covered with a deductible of I think it's about $350, and it's an 80-20 split. And so it goes by the Aetna in-network as compared to if they're on campus and we're sent to an Emory provider, it's that $150 deductible 90-10 split. So there is good coverage at home, but it's different than when you're in town on Emory's campus.
Great. And then a question about the charges. We know that the insurance waiver form isn't actually due until September 15th. But the fall bill comes out a little bit earlier. So just how to reconcile that bill.
So it takes several days, and you'll receive an approval for the waiver, and then that goes to student financial, it goes to OPUS, then student financial. So it does take a while for the domino effect for that to be lifted from your bill. But if it's not done within a week, definitely reach out to us so we can check to see what the barriers are.
And then one more question, I think it's been asked twice. If there's a POA, how do parents submit that to Emory if students already have a POA?
This is a very good question. We've had people put it on the portal, and also have your student have a copy. So if they're going outside of student health, because student health again is a contained system, so not accessible to either the hospital or anyone else. So it would be useful for care here, but any other care they should have it on them, have it themselves.
And a POA, I don't actually know what that stands for.
Power of attorney.
Power of attorney. Thank you so much. So lots of questions here.
Just one question I saw, Sharon, that might be helpful is we put the immunizations. When do you recommend they get a flu vaccine?
So the flu vaccine, and this might be changing, we'll keep up to date with the CDC recommendations, but I don't recommend that we get it before middle of September. We want it to last through the entire fall season. So if we get it too early, especially in August, I'm a little concerned that it won't be as robust of protection when we come January, February, March. And that's, as we know from this past year, that's the time we really want people to be protected as much as possible.
And where can students get that on campus?
Pardon me?
Where can they get it on campus?
Yes, we'll be able to offer it at Student Health. And again, we're going to have a large flu shot campaign around campus with local pop-ups and clinics that are available.
I am seeing a lot of individual questions about, will my insurance plan work or not? I'm really going to encourage families who have questions about this and making that decision about using their own insurance or Emory's insurance to email mandatory insurance at listserv. Blaze is actually putting this back in the chat again. Sharon's staff is amazing, and so they will really be able to answer your specific questions with the policies that you have or the plans that you have to make the best decision for your family.
Absolutely. Thank you all. And good luck. Congratulations.
We have a few more slides. About transition of student health. Really, these are very similar to some of the other things that we've discussed in our earlier slides. If you feel like you need to see your home providers now, doing that one last coordination is really important. Sharon, do you want to talk about updating prescriptions? And then I think Bridget and I can chime in about how important it is to do this before you come to campus, because we have, and Allison's nodding too, we often have students say, well, I thought I was going to go home, or I thought I had enough to get me through 90 days, and then they're out. So I'll let you chime in on those.
Absolutely. So coordination of care is key. As you can see, we're very coordinated here at Emory, but we want to make sure that the primary care or primary provider is coordinated with us. So meeting with them over the summer to get all the prescriptions ready, all the either record release, getting documents like for ADHD, getting the psychoeducational report ready to either upload to Allison or myself or Wanda is going to be really key to make sure that there's an easy transition of care. Our campus is flanked by 2 CVS facilities, so that is usually the provider of choice for pharmacy because they can transfer it. Make sure you do have enough medications, that you're not running out. And if they're only giving about 3 months, making sure that there is a timely reach out to either student health or psychiatry to get an appointment to refill the medication and reassess. So make the appointments in Atlanta, either for a specialist or also within our system in 2 weeks or 3 weeks beforehand, maybe even longer for psychiatry. So reach out so that there's no gap in care. And some providers will actually give, especially for people with chronic disease and things that are a little bit more complicated, they'll give a summary letter to the provider to make that transition of care to student health a lot more robust. So that's something that you can ask for from your provider.
Yeah, we have a nice, Wanda, if you want to kind of chime into, or Allison as well. We know that this is a big transition time. And so for the things that you already know are working for your students, we really advise you continue that care. There's a lot of new things happening in college. So cutting meds cold turkey or going without your accommodations just to test it out probably isn't the to test things out. So, your students, them the best. So just having that plan for that continuity of care and that transition, having it in place so there aren't gaps is really, really important, and a great time to have those conversations with your students now.
Mm-hmm.
Thank you for that. I would also add too, like the accommodations are very helpful and we want you to get those set up. But if you're not managing your own care, your student isn't, sticking to their medication regime, that's automatically going to put them in a situation where it's not the best outcome, and accommodations won't solve that. But we want them to have those things in place because it's all part of them managing their disability and their needs within this environment, coming with this transition.
And I know we're a little over 1 o'clock. We have a few more slides just to make sure everybody has the information that they need. So again, this is a series of Family Friday webinars. They are taped. They will be posted on our website. If you missed our first one a few weeks ago, we talked a lot about FERPA. Sharon mentioned FERPA, our Family Education Rights and Protection Act. We also talked about getting guest access to OPUS. And that's really important as we're talking today about access to the insurance waivers, the bill. Bill's super important. So if you missed that webinar, please feel free to go back and watch that. Our next webinar is scheduled for July 10th, where we will give a little preview about registration. I also know there are lots of questions about orientation and move-in, and if students will be required to be tested before move-in. We are working on all of those, we promise you. And so we really want to make sure we get the right messaging out to you. We are very hopeful to have a message about orientation and general move-in by the end of the month, by June 30th. And then, of course, we'll always update information on our emory.edu/forward website, which is a great place to get all of the up-to-date information. As you can imagine, we're getting new information hourly, daily, and so really appreciate you all hanging in with us so that we are having your students come to Emory in the safest way possible with the best experience possible as well. So we will stay on the chat for a few more minutes just to look through. Bridget, anything else that you want to share before we officially sign off?
Yeah, thanks, Sherry. I think we've just given you so much information that don't hesitate to go back to this video and don't hesitate to go to the websites that have been listed or the information that's been listed. We don't expect you to just grab all this at one time. So please, we're going to be patient and we appreciate your patience too. There's a lot to cover and we want to make Emory easy for you in a very complicated time. So we're looking forward to seeing you and hope you see you at the next family webinar, and please let us know how we can be helpful.
Yeah, the other great resource, because there was a lot of questions about, I still have a question, I'm not sure where to go. on our college.emory.edu/orientation page, we have a great resource, or two of them. One is our summer checklist, which we are updating as soon as we have new announcements. So things about when your students will register, all of that will be updated. But we also have a really great document called our reference pages. And we've partnered with all the people on this chat and others. So their websites are in those reference pages, their emails are there too. And although people don't really always know this, higher education professionals work year round. So we are answering our emails, we are working on that. So please do not hesitate to send those messages on. It's often best to direct the questions to the people who are the experts in those areas. If you're not sure where to start, ec.orientation@emory.edu is our orientation hub email. And we are also very happy to warmly refer you to the right office or try to get you to where you're going. So appreciate all of the reach outs that you've been given as well. All right, well, thank you so much, Wanda, Allison, Sharon. This has been so helpful. Bridget, as always, I love co-moderating with you, so appreciate everybody being with us this afternoon. And we hope to see you in a few weeks with all sorts of new information for the fall. Have a great weekend.
Thank you, everybody.
I think we are not live anymore, so that's like